Welcome to the Financial Flossing Podcast with Ross Brannan, guiding dental professionals to a brighter future. Ross Brannan is a financial advisor who knows it's not just about your teeth. He helps dental practice owners protect and maximize today's cash flow to plan for tomorrow's cash needs. Find him at rossbrannan.com. On the show, he brings together experts to help dental professionals looking to make smart money decisions to grow their income, turn their retirement goals into reality, and improve their lives. And now, here's your host, Ross Brannan.
Welcome to the show. My guest today is Stephen Kupferman. Stephen is a founding partner of the Los Angeles Center for Oral and Maxillofacial Surgery and the CEO of Medva, a virtual medical staffing service. Today, he is our guest on Financial Flossing. Stephen, welcome to the show.
Thank you. Thanks for having me.
Sure thing. Well, you have a very interesting story because you have two really cool things to talk about here. You are an oral surgeon in Los Angeles, and you're part of, I think you said earlier, the largest oral surgeon practice in the United States, potentially. Is that right?
Well, I would say that we're probably one of, if not the largest in one office, and one of the largest oral and maxillofacial surgery practices that practice out of one office, because most oral surgeons have multiple offices to operate out of. But we're pretty large. We're 6 doctors, and we have a very broad scope of practice where we do sort of a basic kind of dental alveolar surgery all the way to things that are kind of more esoteric, like jaw reconstruction and orthodontic surgery and things like that. So it's a lot of fun. It's just really just tremendous amount of energy, and I love it. I love it every day. I
would not want to be the guy getting his jaw reconstructed, not because I wouldn't trust you. I just would not have had to go through the thing to need my jaw reconstructed. So I'm sure you see a lot of crazy things just from the trauma standpoint, don't you?
Yeah, we take trauma call at one of the level 1 trauma centers here in a very large hospital. And it's, trauma is unfortunate, but, oral and maxillofacial surgeons are very well trained to handle all trauma of the face. And it's very rewarding. You get to take care of people when they're, very vulnerable. And so it's just a very rewarding part of oral and maxillofacial surgery. And it allows, the practice of oral and maxillofacial surgery is so diverse. I think of all the dental specialties, sort of maybe besides general dentistry, oral and maxillofacial surgery has so much diversity to it. There's so many niches within the practice of oral and maxillofacial surgery that just makes it so engaging and rewarding on a day-to-day basis.
Well, most of the people listening are dentists or they're in the dental field. And so most people know this, but I'm sure there's some people who don't. So as an oral surgeon, you're a medical doctor and you're a physician and you're a dentist as well. So you have the MD and the DDS, and most just have one or the other. And your residency was 6 years, correct?
Yeah. So the residency is 2 years of medical school. So you have to do the last 2 years of medical school. And then 4 more years of residency, which includes general surgery, some anesthesia training, and then oral and maxillofacial surgery as the bulk of it.
Yeah, that's a lot of work. I mean, when you actually finished all of your training, how old were you?
I was 32 with 3 children and a lot of debt.
I mean, that was honestly like what the level of training that a neurosurgeon has.
Pretty much. I mean, when the neurosurgery training has changed a little bit. It may now be down to 6 years, but it used to be that you'd had to do at least 7 years of training for neurosurgery. It may still be that, and then they go on to do fellowship. So, it's within a few years. So it's significant. It's a lot. It's a lot of years. It's a lot of years and a lot of dedication and hard work. And you don't realize it when you're in the day to day and everything in life, really, right? When you're in the day to day of things, you don't really realize the grind that you go through. And I remember when my parents and in-laws and my wife made a little party after I finished my residency, and one of our friends came over and said, "Oh yeah, we're so excited. We're coming to the party that you're having." And I was like, "Yeah, whenever, it's a party." And she looks me in the eye and she says, and this is one of my wife's close friends, and she looks me in the eye and says, "It's a big deal, Stephen. It's a big deal. You went through a lot." So, I didn't realize it at the time, like how much you go through in training, whatever you're training for, even just dental school, it's a lot. There's a lot of sacrifice. And if you have a family, and I mean, there's a lot that goes into that.
Oh yeah. Yeah. So talk a little bit about the dynamics of your practice, being that it's a big practice, you have a lot of partners, and talk a little bit about that dynamic. And then we'll talk a little bit about your other thing that kind of spurred off because of some challenges you had.
Yeah. So, I really was very lucky that I did my residency with a guy named Ben Wallin, who's from Nebraska, as different as I am from New York. And we started residency in 2001 together, finished together. And then we actually worked for Kaiser together for a little while. And then in 2009, I realized that I wasn't able to, or wasn't going to be able to support my family, on that, sort of, W-2, income from a large hospital, in Los Angeles. It just wasn't sustainable. So I just left and I just went on my own. And it was, of course, 2009, which was not an ideal time to make that decision. But I went on my own and I started a practice actually in a plastic surgeon's office, on my own, and, bought a Panorex machine and an EMR, and within a year, I called Ben and said, like, hey, you got to join me. This is just too much fun. And we can do the same things we were doing there. And then we just kept, growing and growing and growing. And, now we're, 6 surgeons, and it's in one office. And, we focus on basic oral surgery and large sort of full scope oral surgery. And it's just, so much fun every day. I really enjoy going in. And the hardest part, I love the surgery. The surgery was great, but the hardest part was just really managing the day-to-day operations of a practice of multiple doctors with multiple employees. And so it got to a point where I just had so many employees that were, that I was working with on a day-to-day basis, that I just saw that in order to keep growing, we'd have to get more and more and more people, on board to really run and manage and handle the day-to-day of the operation.
And how many employees do you have now?
So now we have about 20 people working in the office.
And before, what was the most you ever had?
I think we had in like low 30s.
Okay.
Low mid 30s.
A lot of people to manage.
A lot of people to manage when you're seeing patients 4 days a week.
Right.
Yeah, a lot of people to manage. And I just was, I was, reading a lot and looking things up and just, constantly trying to work on practice management. It was kind of just part of the sort of day-to-day thing that I was doing. And the surgery was straightforward and pretty easy for me. And I sort of came across the idea of having remote employees. This is 2018, 19. And I realized, I started reading about it and looking into it. And I said to myself, wow, this is really, really good. Like we couldn't do this 10 years ago. Internet speeds weren't fast enough. The idea of having somebody answer your phones, call out, from your office, from another location, was really not available in 2005, 7, 9, the world was much less technologically advanced. And I started, sort of thinking that, oh, wow, this is like, 2 lightning strikes at the same time. And I said, wow, well, maybe I can just get some people to just help me out, just to answer my emails or, handle calls or, just keep my schedule in order. And then I started to think, well, maybe they can just make phone calls for billing related matters, just calling, insurance companies. So I hired my first person from the Philippines, and he was just like a godsend, just so polished, RN, a nurse who really just was just a great, just a very dedicated employee, essentially, even wasn't really an employee. And it was like the lights like went on, and I realized that this was just an incredible opportunity, for me. Then I just started thinking out of the box, like, wow, if you can do that, well, can you do this, and can you do that, and do this, and do that, and do this, and do that? And so I just started bringing on, more people to handle all this workload of running a large practice. and it just really just took off really from there.
So hiring people is the toughest challenge. And, sometimes people are concerned about hiring international people because of, accents or how well they speak English, things like that. But obviously, there's a lot of travel nurses in my town from the Philippines. The Philippines is very Americanized in many respects. And so, as we talked about earlier, offline, you've got the Great Resignation now, and to get somebody the low end of the totem pole in a dental practice in Los Angeles is $20 an hour compensation. That doesn't even account for all the other costs that are involved. And so you're like, well, let me try one of these people, and it was a home run. And you're like, okay, maybe I can do more.
Yeah, that's how it happened. It was a home run, and I actually got 3 more, and then I said, I've got to go to the Philippines.
Oh, you actually have to fly there?
Well, I said, I got to go there. I got to find out, I got to see what this is all about. I got to meet these people. I got to, talk to them, take them out to dinner. I'm going. So however many years ago, and we were going to do an anniversary trip. My anniversary is in the summertime, and so we were going to go to Thailand. And so I figured, hey, it's close by. Why don't we make a stop? And so I stopped in the Philippines for a day and a half, 2 days, and I had 4 people at the time, and 3 of them came to meet me at the hotel, and they treated me like a king in many ways. Like, they came over to me and said, you're real. Nobody ever comes to visit us. We're so grateful for the work you provide us. And
wow, appreciation, thankfulness.
And, my wife and I were like, wow, this is incredible. And, they grabbed my arm. I'm like you, I'm a big guy. And they're little. And they grab my arm, as if, they were just so grateful. And it was just incredible. We went out to dinner, and I said, I had some meetings set up to find places where I can just do this on my own and share this with all of my friends. And, we went out to dinner, and, we went around town, and, we even visited the largest American military cemetery in the world, which is in the Philippines, from the Pacific Theater. There's
wow.
And that was sort of serendipitous. We were actually driving on the freeway, and this is part of the whole story of working in the Philippines. That the traffic there is horrible. I don't know what it's like in Tallahassee, but in California it's bad. This doesn't even compare. You have no idea what it's like. So I said, get off the freeway. I can't sit in traffic. I do that in LA. I'm not doing that here. We got off the freeway, and there was this gorgeous green cemetery. And it was, I looked it up, and it's the largest, American military cemetery in the world, I believe. And I just got out of the car, and they wouldn't let them in initially because it's American property per se, I think. So I just flashed my passport, and they're like, hey, you guys can go in. And we went in, and I paid my respects, and, it was fascinating, just to see the connection and the respect that the people in the Philippines have for the Americans. And so, that we spent, just a little bit there. It was really we just got off the freeway. I was like, what is that? And I was like, oh yeah, that's a cemetery for the American soldiers, and people haven't been, these were 18, 19, 20-year-old, American servicemen who, died in the Pacific Theater, and they were all buried in the Philippines. So it was very touching in many ways. And it was also very, very much, endeared me to, to the country and to the people there. So we wrapped up the trip, and then I was all in. I was like, this is great. Like, I have a connection here. I started to realize how traffic was impacting healthcare professionals there, and that they could work from home and be involved in medical practice in the US, even though they didn't have to leave their family and friends who were in the Philippines, like, people do in
travel nurses do.
Exactly. And I just realized, wow, like they can, I realized how great it was for them, that they were getting American dollar pay, and they were getting the ability to work, remotely before remote work was a thing. They were getting the ability to not sit in traffic. I had one of my virtual assistants was a nurse. She had a 3-mile commute, and it took like hours, literally.
What? She might as well walk.
Or maybe it was a 3-hour walk and a 3-hour like commute.
Oh my gosh.
On the car. So she just put sneakers on and just started walking and told me that she was doing that. And I was like, oh my God, this is like, you can do anything you want in my practice. Obviously it was just great to hear those sort of things. And, they work at night, obviously, and then they can be with their kids during the day. And it's a good opportunity. Most nurses know that they have to work the graveyard here and there. So
you have 4 people, you go to the Philippines, you meet them, you're like, oh my gosh, this is amazing. You have 4 people, and you're like, and then you start expanding. And when did you say, oh, I gotta turn this into a business? When did that happen?
Oh, it happened before I even went there. I already realized that this is great. I have to tell my friends about this. I got to do this myself. This is just incredible. It's the future. And so then I went, and then, I just started setting things up, and I just basically set it up. I brought in one of my, close colleagues who's a gastroenterologist. And I just said, do you want to do this? And some people actually told him about it beforehand. People that we knew mutually would say, hey, why don't you do what Steven's doing, And then he's like, nah, yeah, I'm good. I've got whatever. And, he was struggling with his office, just didn't have enough staff, and just people couldn't get into his office. And, he's a community doctor. He knows a lot of the people that he treats, and the same with me. And so then he was like, okay, I'm going to call Steve. He calls me, and I was like, yeah, let's just do this. Let's do this together, Omid. And so we decided to do it together and started it. And the rest is really history, and it's been great. It's been very rewarding.
So how did you get the word out, and how much has it grown? And did COVID accelerate it even more?
So COVID definitely accelerated it. COVID testing facilities need people to handle all of what is involved after you get the swab up your nose. And so it definitely accelerated it in many respects with that. And people, doctors and healthcare facilities have, are starting to understand that the non-clinical people can work remotely. And that if you have nurses working clinically in your facility, in your office, in your surgery center, in your hospital, that you could also have the same people who choose not to come here and decide to just stay home and be in the Philippines to do, those same people do all that other work. And, we've been able to expand it to so many things that we were doing with, people in the office that we can't find right now. And they, they handle it. There's hiccups here and there, just like anything else. But the platform we set up and the way we've set it up has allowed us to really grow and, and facilitate more and more offices that need people to work in the office. So
how are you getting the word out, and how fast are you growing? I mean, are you spread all over the country? Do you have clients in 50 states now? And how does it work?
So I don't know if we have clients in 50 states, but we have plenty of clients. We have several, we have a lot of clients in different parts of the country. We don't really have a lot of international clients, but we have a few. How does it work? The way it works is we have a recruiting team that finds very talented people. We train them. And when somebody calls and says, I need people, we have them ready to go. And they've been sort of trained. All of their, technical issues are more or less ironed out, and we'll send you several resumes, usually a video resume, and you say, hey, I'll take this person, and then you interview that person, and then you hire them, and they start working for you.
Any of your clients, have they ever had a bad experience?
Well, I'm sure that there are people who have had, issues, whether it's some technical issue or whether they hired the wrong person or whatever it is.
But overwhelmingly, it's a phenomenon. Your clients are pleased.
Yeah. I mean, I think in any business, there's always.
But let's talk about the two things that are the reason why this is happening. One, finding people in this job market here in the United States is incredibly challenging. I mean, we're recording this in May of 2022, and right now finding people is the biggest challenge for business owners. I mean, I've been to Starbucks and Chipotle where they're closed because they have staff issues. And so it's absolutely going to be an issue where you live in Los Angeles at $20 an hour doesn't go very far in Los Angeles. In other places, cost of living is increasing everywhere, inflation. And so finding someone, number one, and then two, the cost of having them. And then they might leave tomorrow for a job for $1 more an hour. You're providing people who are grateful, as you gave the example of when you were in the Philippines, but also at a pretty substantial cost to the end user. So if I call you and say, Stephen, I need an employee, I can't find anyone for less than $20 or $25. What's it going to cost me to hire someone through your firm?
So we charge a flat fee of $10 per hour.
I'm sorry, what'd you say?
$10 per hour.
I'm sorry. I thought you said $10 an hour.
That's exactly what I said.
Which is about half of what it would cost for anybody in the United States to hire someone today.
Correct. It'd be half of what minimum wage is, or at least 50% less, but probably half if you're adding into taxes and all the other benefits. Yeah, it's a fraction because for the same reason, when you go and buy milk in, India, it's also like an eighth of the cost because of the way in which the American dollar is arbitraged in other countries. The American dollar is very powerful, and it can be used, in other countries to go way further. Just like the California dollar doesn't go anywhere near as far as it does the Tallahassee dollar. So that's why the amount is so low. But it's a lot higher, at least 50, in some cases, 100% higher than the salary of a healthcare professional in a hospital or a skilled nursing facility in the Philippines. So it's a very good job for them. We provide great healthcare and retirement benefits. And so that's a function of how far the American dollar goes outside of the U.S.
So what positions can these roles fill? What is the ideal position?
So in the dental office, it's the easiest way to get started with this is if you have somebody who was used to be calling in the insurance companies and asking what the benefits are, how much they cover per year, what percentage they cover for this and that, how much is left. That there are, of course, systems that do that already, but they're not as accurate, and you're sort of left with the information that the website may give you. And most offices that are efficient don't use that. They'll have somebody calling to find out what the benefits are. So that's the easiest way to get started in a dental office, by having somebody who does benefit verification. And just calling the insurance companies, finding out, how much it's going to pay. So how much to charge the patient, and how much the insurance company is going to pay. Probably the second easiest way is to start handling the EOBs from the dental insurance companies that often, for whatever reason get denied. They don't fully pay, they give an excuse that it's not a covered benefit, whatever it is. And you have to call the insurance company and say, hey, Mrs. Smith, this was supposed to be covered, and they say, oh, you know what, it's covered. Let's, we'll send you the money. So that's another, job that's done in an office. It depends on how big your office is, how many claims you have, whether you need somebody to do that. And then hygiene recall, there's always somebody who's calling to, bring in, Mrs. Smith, hey, it's time for your cleaning. Can we put you on the schedule for Monday? And you could expand it based on what you do in your practice on a day-to-day basis.
I mean, this just seems like a no-brainer. I mean, I'm not suggesting you go fire your existing staff, but as you have turnover, obviously one way to deal with inflation is to cut costs. This is a way to cut cost, and I just see this as a no-brainer. I mean, obviously your clients are loving it, are they not?
Oh, yeah. I mean, the clients love it. The only time that they're not happy is if there's a problem with the person, and there's a work issue or some other related issue. But yeah, it's a no-brainer. It's totally a no-brainer. There's really no reason not to do it. Even in California, real estate is a problem. Having space for staff as you grow in an office is a problem, and just that alone will cover the cost of a virtual assistant. So yeah, it's totally totally a no-brainer.
So if someone wanted to learn more about this, if they're like, this is a really intriguing concept, I haven't thought about this before, or, hey, I'm having trouble finding people or keeping people, how would they get in touch with you? How would they learn more about this?
So just getting back to, yeah, I wouldn't fire anybody who's working for you because they're fantastic people.
Exactly.
I've never done that. But when people leave and they give you, if you're lucky, 2 weeks notice, we can get you somebody within a few days who's, had some training. Now you have to onboard anybody in your office because every office does things differently. And even pronouncing the doctor's name is part of onboarding. So onboarding is going to take some time either way, but we can get people in your office within a few days. And you just have to go to our website. It's really simple. You go to the website, you fill out a form, they'll, set up a meeting with somebody within the next.
What is your website?
www.medva.com, medva.com.
Perfect.
Yeah, you just go on there and you'll fill out a form and it'll take you to the links and you'll schedule an appointment with one of our virtual assistants who will find you, very qualified people to do whatever is needed in your office.
This is fascinating. I think this very well could be the future of administration in healthcare for a lot of people.
Yeah, you still need a core of people in your office. And if you have, I have some referrals of mine, like they have no employees, like literally, like maybe their wife is answering the phones part-time and then they're suctioning for themselves and doing their own dentistry like I did when I was a dental student. And that's great. They have no overhead. Okay. They keep everything that they do and it works great for them. But, when you have a really, really small office, you don't need somebody, or maybe you do. Maybe it's worth, the $10 an hour, for whatever number of hours, a month, to have somebody just to answer the phones. They can't suction for you, but they can answer the phones. But for any practice that's sizable, this is, as you said, really a no-brainer.
Yeah, this is it's definitely worth considering. In the world that we live in today, I can't imagine this not being a topic of conversation when you have to hire somebody on the administrative side of the glass.
For sure.
Yeah.
It is in every company. It is, we've just launched a new business line for the company called BizVa, and it's going to provide, sort of non-medical personnel help, whether it's with accounting or whether it's with data entry, just, any help that any, office may need. So we're launching that very soon. And it's just another way to really maximize, the way in which you do business on a day-to-day basis.
Yeah, that's awesome. Well, we're out of time today, but Stephen, this has been a fascinating conversation. I really appreciate your time today. And the website's medva.com, medva.com, right?
That's correct.
Yeah, I just can't see why anyone wouldn't be logging on that website very, very soon. But thanks again, Stephen. I really appreciate your time.
It was great meeting you and great chatting with you today.
You've been listening to the Financial Flossing Podcast with Ross Brannon. Tune in next week for our next episode.
This has been another episode of Financial Flossing with Ross Brannon, guiding dental professionals to a brighter future. If you liked what you heard, consider subscribing wherever you listen to podcasts. For more on Ross Brannon, visit rossbrannon.com.
Registered representative and financial advisor of Park Avenue Securities, LLC, PAS, OSJ 3664 Coolidge Court, Tallahassee, Florida 32311, 850-562-9075. Securities products and advisory services offered through PAS, member FINRA SIPC. Financial representative of the Guardian Life Insurance Company of America, Guardian, New York, New York. PAS is a wholly owned subsidiary of Guardian. North Florida Financial is not an affiliate or subsidiary of PAS or Guardian. California Insurance License Number 0L10073. Arkansas Insurance License Number 161-39032. 2021 119535. Expires 4/23. That last part can also say 2021 119535, expiration April 2023.
This podcast is for informational purposes only. Guest speakers and their firms are not affiliated with or endorsed by PAS, Guardian, or North Florida Financial, and opinions stated are their own. External sites and material are provided for your convenience in locating related information and services. Guardian, its subsidiaries, agents, and employees expressly disclaim any responsibility for and do not maintain, control, recommend, or endorse third-party sites, organizations, products, or services, and make no representation as to the completeness, suitability, or quality thereof. Ross is a registered representative and financial advisor of Park Avenue Securities, LLC, PAS, OSJ 3664, Coolidge Court, Tallahassee, Florida 32311, 850-562-9075. Securities products and advisory services offered through PAS, member FINRA SIPC, financial representative of the Guardian Life Insurance Company of America, Guardian, New York, New York. PAS is a wholly owned subsidiary of Guardian. North Florida Financial is not an affiliate or subsidiary of PAS or Guardian. Arkansas Insurance License Number 161390032. California Insurance License Number 0L10073. 2021 138480. Expiration 0524.